Welcome to Physicians Keepers. Each episode features honest conversations with physicians, sharing moments that shaped them, challenged them, or taught them something worth passing on. These stories come from every corner of a physician's life: the clinic, OR, family, finances, mental health, leadership, and personal growth. If a story can help another doctor feel seen or strengthened, it belongs here. It's about honesty, courage, and community true storytelling. If you are looking for connection or a reminder that you are not alone in navigating this profession, you are in the right place. Hello and welcome to another episode of Physicians Keepers. I'm excited to have you back here today. If you're watching on YouTube or you're listening on Spotify, thank you for joining us today for yet what is going to be another exciting and insightful episode with Dr. Sodaitis, and I'm excited to have her here. Thank you, Dr. Sodaitis, for joining me here today.
You're welcome. It's great to be here.
So I'm just going to go ahead and read Dr. Sodaitis' bio, and we're going to go straight right into the session today. So Dr. Sodaitis is a board-certified pediatrician, and she's a fellowship-trained academic general pediatrician who transitioned from academic medicine to health plan leadership in 2013. She currently serves as the Chief Medical Officer for Atrio Health Plans. Dr. Sodaitis built her career at the intersection of medical management, quality, and operations, helping organizations deliver care that is high quality, equitable, and genuinely centered on the people they serve. In her role as the Chief Medical Officer at Atrio Health Plans, Dr. Sodaitis focuses on strengthening clinical operations, supporting providers, and building systems that ensure that members receive the right care at the right time. She also brings a background in medicine and leadership coaching, holding advanced certifications across several coaching modalities. With lived insight into neurodivergence, she supports physicians in embracing their strengths and moving beyond the limiting beliefs that accompany diagnoses such as ADHD, learning disorders, or autism spectrum disorder. That's quite an accomplishment, Dr. Sodaitis. Thank you for just everything that you do in the physician community.
Well, thank
So
you.
going into just from your bio, I mean, from what we just talked about, you were trained and practiced as a pediatrician and also an academic physician. What was happening to you career-wise that made you transition out of clinical medicine?
Yeah, so I was in an academic faculty position in a job that I actually really liked the job itself,
Yeah,
but the leadership was even at that time I knew it was toxic. Even before
yeah,
toxic was sort of a buzz phrase, but
yeah, yeah,
I
yeah,
was really unhappy with the leadership.
yeah.
And back then, I don't even think we had LinkedIn, and if we did, it was, rudimentary compared to what it is now. And so I just did a search. I did an internet search. I can still see myself sitting in that office. And at the time, I was a medical director. I was medical director of the mother baby unit.
Yeah.
And so I just searched medical director Chicago. And what came up was there were several jobs that came up, but a health plan utilization management medical director job came up. And just to give a little bit of background, in my fellowship, I sort of got very interested in managed care. My fellowship program director had a job that part of her job was was in a health plan, being the medical director of a health plan. And I was really interested in it. I had managed to incorporate aspects of it into my academic practice since fellowship. So it was
Yeah.
something that was always in the back of my mind. I had no idea that those sorts of jobs existed. And so when I saw the job description for utilization management medical director, I knew immediately that this was the job for me,
Mhm.
that this would be a job I would really, truly enjoy. So I went ahead and applied, and I had a very nice recruiter who did call me back and told me in the nicest possible way that I wasn't qualified.
Wow.
And but she also gave me several suggestions
Okay.
about what I could do to be more qualified. And then I started reaching out to a couple of other people who had made the transition from academic medicine to health plan leadership, and they gave me more suggestions.
Yeah.
So over the course of about 15 months, I got a little more education, a certification. I joined some other committees so that when the next health plan medical director role came
Yeah.
across my desk, I was ready for it.
Yeah.
And I applied and I got it. And as they say, the rest is history. And I have not looked back.
Oh, wow, that is awesome. Now, a lot of physicians, they come to that point where they look at their life in clinical medicine, clinical practice, and they see themselves, maybe wanting to do something outside of it. But there's this identity shift that they struggle with because they don't know how to see themselves outside of that role. What did that look like for you? Like, how did you finally make that transition to say, okay, I think I've done enough with clinical medicine. I'm okay. I'm okay with leaving this behind, and I'm okay with exploring other things that will contribute to healthcare, but in a way that I feel that is right for me, in an environment that I feel like would bring out the best in me and not make me dread the whole field of medicine. What were
Yeah.
the internal things that were playing in your head?
Yeah. Well, first, completely honestly, I didn't leave clinical medicine completely. So when I got the job offer, they wanted me to start in 2 weeks. I
Yeah,
negotiated for 4 weeks, but you know how in medicine, like we usually give 3 months
yeah,
notice.
yeah, yeah.
And I was the one who made the call schedule. And so I knew what the call schedule was and I knew where I
Mhm.
was in the call schedule. And, being a physician, being a woman, I have had still do have a high sense of responsibility.
Yeah,
And so I still did a lot of moonlighting. It mostly in the mother baby unit, in the
yeah,
newborn nursery, and also on the weekends in clinic. So I would say those first 3 years after leaving my full-time academic practice, I was probably in the hospital close to one weekend a month. So I didn't leave completely, and it tapered off slowly until a few years ago, there just weren't that many opportunities. I was spending more time doing keeping my privileges up, doing those,
yeah,
learning management system courses on hand washing and, fire prevention than I was actually moonlighting. And I thought, you know what? I think I'm good.
yeah,
Um, I think I can let this go. But the the idea of losing your identity, I'm still a physician. I still have a job, and
yeah,
most people will tell you who work in utilization management and probably also in some other non-clinical, like pharmacological careers, you have to maintain your licensure. You have to maintain your board certification. They need people who have our clinical knowledge. And
yeah,
so we're just using that clinical knowledge in a different way. Instead of taking care of patients day to day, we're using that knowledge and learning more and more. I know a lot more about medicine than I ever did
yeah.
in clinical practice. And I'm using that and I'm using the tools and the skills that I picked up for critical thinking and decision making in my job.
That is awesome. And it's one of those things where now at you're at a I would say, but I say a realm, or you're in a position now, right, where you can affect those changes that you wanted to, things you wanted to change as a clinician, right? Because some of us are in systems, right, where we complain about the system, we don't like how it's set up, but then we really can't do anything about it because we're not in those positions to make that decision, right? And so as a physician, for someone who has been on both sides, right? So then you've worked as a clinician and now you are in the leadership role, right? Where you are in the health management role. You have enough experience and wisdom, right? Where someone who hasn't done that, who's in that position, wouldn't have a clue as to what works. What actually works. It's fine. You can make this policy change or you can make this decision change, but does it actually work in a clinical setting. And so having physicians like you who move into those roles, I believe it's a win for us, because then you are our voices in this, making decisions that will ultimately benefit not just us, but also benefit our patients. And I mean, that's the way I see it.
Yes, yes. I'm frequently taking the thinking about the person in practice and what they have to, what they're facing, what what this change might mean for them from a, bureaucratic standpoint. I mean, we know managed care, prior authorizations, all of that. It's a hassle.
Yeah,
There's red tape.
yeah,
And, most physicians are doing the right thing at the right time.
yeah,
It's unfortunate that we have to have these systems in place to prevent people from not using evidence-based medicine to find where the fraud and abuse lies,
yeah.
um, so that we can continue to afford to pay our medical costs.
Absolutely, absolutely. Well, like I said, it's a joy to have physicians like you over there. Now, you said you had to go through like a 15-month, preparation. What was that like for you? Like if someone who's listening to him is like, that's something I really want to do, but I've always felt unqualified. Like when I see those roles come up, I'm like, I don't think I know enough about this. Like, and they just skip through. Was it costly for you to have to go back to like get all these courses to prepare yourself? I mean, you mentioned definitely that you did reach out to other people who were in the field, which is something I always encourage physicians to do. If there's something you want to do, you have to ask those who's gone ahead of you, like, how did you do this? But what resources like did you use during that time to prepare you for where you are right now?
Yeah, yeah. There definitely are many more resources now than there were, 13,
Yeah,
15 years ago. So, I looked for, there is an organization called the American Association of Physician Leadership that has many, many courses. They have an annual conference. And so that is a resource that I recommend to many people to take a look at. There's also the Seek conference, CEAK, that is a very nice resource for people who are looking for non-clinical careers. And then just more broadly around, if you are thinking of leaving clinical medicine, even part-time, I think it's really important to know what you're leaving for, because if we're running away from bureaucracy, stress, lack of autonomy, most jobs are not, unless you decide to be an entrepreneur,
yeah,
most jobs are not going to give you what you're looking for. So you really want to do some soul searching and
yeah,
figure out what is it about this job that is either causing me to experience burnout or is making my life so unpleasant that I want to leave clinical medicine that I trained very hard for. And then explore, UM is the one that gets a lot of people. It's polarizing because a lot of
yeah,
people don't like it. It's also what most people are sort of the fallback.
yeah,
And they figure, oh, I'll just go ahead and do some, review cases. But there are so many other options. There's medical writing. There's being a medical science liaison from a pharmaceutical company. Depending on depending on your kind of subspecialty,
yeah,
there can be many companies that are looking for your knowledge and your expertise in the development of, orphan drugs. And so what is it? You can go into quality. If you can take an entire course
yeah,
just on quality. If you love QI projects, you could become a quality director. That may not be a physician role,
yeah,
but
yeah,
having a physician in that role is an asset for many, many companies. So I knew what I was going for
yeah,
and what I was interested in. And so I did do the course through, it wasn't called the American Association of Physician Leadership, something like that. It had a different name back then, but I did
yeah,
do a course that was called PIM, or Physicians in Management. I joined my utilization management committee in the hospital. I became a Lean Six Sigma yellow belt so that I understood sort of, process improvement. I never really liked that quality, whatever that quality circle is, like
Yeah, yeah,
that just doesn't light me up. But I really do like Lean Six Sigma, and Kaizen, the Kaizen process and
yeah,
that sort of thing. So, um, find what find what inspires you, find what
yeah,
drives you, and don't be in a rush. Be on the lookout, but try and be patient and have your heart and your ears open.
yeah.
Because when you're in a rush and you're running away from something, you can't make a good decision.
Yeah,
Physiologically, you can't make a good decision when you're in that state. And
yeah,
certainly not when you're making a big decision about like a career change.
yeah. And one of the things that I hear, even people that go into private practice, because I had a guest the other time where she said, a lot of times you see physicians jumping to something out of burnout, right? I want to go into private practice because I'm burned out. She's like, you have to move into a different space from a place of abundance, and not from a place of lack,
Hmm.
because you would end up discovering that the same place you're running to may not feel that void that may not feel that void. So thank you so much for those insights. Now we're just kind of going to shift gears a bit, because based on your bio, there are a lot of things that you have stepped into, and are currently doing in the physician's fair. But as part of your role as a leader, because that's one of the things you do, I want you to be able to shed more light for physicians, because most physicians don't realize that they are actually leaders in the organizations, the environments that they work in. And it's not uncommon to see us shrink from leadership roles where we just want to focus solely on, I'm just going to see my patients and just that's it, but not realizing or being afraid actually to actually take charge of certain things. And so when we see opportunities for leadership being put forward, we don't think we are qualified enough to do that. Could you talk a little bit more on that with physicians and leadership?
Yeah. So, I mean, the physicians are de facto the leaders within the setting that they're practicing in.
Yeah.
So whether you believe that or not, it's an opportunity for examination because you think, no, I'm not the leader, it's the office manager. No, I'm not the leader, it's the, division chief or
Yeah.
section chief, whichever you call it. But really not. Like you are exhibiting leadership qualities to your patients because they look up to you. It really depends on what is your definition of a leader. And for many people, a leader is not the person who tells you what to do. That's a manager.
Yeah.
A leader is someone who shares their vision and helps to frame the vision for an organization, a
Yeah.
group. And so just by setting the temperature and the culture of your clinic, you are leading it, whether you realize it or not. And so, since that is the default, why not make it into what you want to make it?
Yeah.
Even
Yeah.
if it is just your 3 rooms that you're seeing patients in, you can set the tone.
Yeah.
You can
Absolutely.
set the vision of the way you want your patients seen and treated.
That is awesome. I hope any physician listening to you right now would just absorb what you said. And like you said, we are de facto leaders. I like that word, whether we like it or not. Now, you are also into coaching.
Mm-hmm. Yeah.
And so, I mean, there's a lot to unpack with coaching. And, I was one of those who was very ignorant about coaching right up until the pandemic. I think that I stumbled into a group, and I was just kind of like, it was just like, my eyes just like popped open. I was like, oh my God, this is something that physicians, I just didn't know. Like in my ignorance, I just didn't know that that was actually a door that was open for physicians, until I started seeing like different aspects of physicians coaching. I was like, oh my God, like this is this is so impactful, and maybe we don't realize it. But as from a coaching standpoint, what are some of the invisible struggles that highly successful physicians carry that no one else sees in your experience?
Oh yeah, that's a great question. So yeah, I'm a coach. I've been a coach since 2019. So I've seen the evolution of coaching where there were like no people didn't even think about life coaching, and
Yeah,
then certainly not physician coaching. And then yes, through the pandemic, coaching had sort of like a renaissance during the pandemic. Everyone was home, everyone was watching, all of their social media. And to the point where now it's somewhat mainstream.
yeah,
It's not
it is.
100%, but it's somewhat for a coach to for a physician to say like, yeah, I have a coach. It's they might get some sort of strange looks, but for the
Yeah,
most part, it's pretty mainstream.
yeah,
And so what I hear a lot from, so I coach neurodiverse physicians, and these are people who have ADHD, have autism, maybe some social anxiety, and so some of the hidden struggles that I really coach a lot of people on, especially women, is the idea of there's two. There's the shame of not being able to do whatever it is that their neurodiversity impacts
yeah,
and is a barrier to doing. So
yeah,
for women with ADHD, from a professional standpoint, it's often getting their charts done
yeah,
or getting out of the office, getting out of a clinic visit in a reasonable amount of time because they
yeah,
tend to want to tell every single thing, document every single thing. And so there's the shame of, I can't do it. I'm running
yeah,
behind. I'm on the naughty list, quote
yeah,
unquote, right, with my charts. But what a lot of people don't see is the people who are able to manage everything in clinic often are really struggling at home.
yeah,
And there's a lot of shame around not being able to fulfill all the tasks. ADHD is essentially a disorder of executive functioning,
yeah,
being able to plan and execute a task. And so things like getting the laundry done, making sure the house is clean, getting your kids to school on time with two pairs of shoes and maybe some socks, and getting yourself to clinic on time.
yeah,
There's the struggle of how to do it.
yeah,
There's the shame of not being able to do it. And then there's managing the your sympathetic nervous system
yeah,
that sometimes gets dysregulated and the level of dysregulation that sometimes they're starting the day at because of sort of the quote unquote chaos of the
yeah,
morning. So, for people with ADHD, especially women, I see that a lot. Now with people with autism, autistics, people with social anxiety, it's all different
yeah,
depending on the condition. The specifics are different, but honestly, the underlying theme is shame.
yeah, yeah. So how does when they work with you from a coaching standpoint, how does that transition where they start to see those things that they thought were limiting or problems, how do you then transition them to play more on their strengths rather than focusing on what they thought were their weaknesses?
Yeah, that's exactly what we do. That is exactly what we do. And so many of them, so much of the coaching is even just discerning what those strengths are. We start out by coaching around what is the particular issue. I have coached people on how do I get the laundry done? How do I not lose my keys every day?
Yeah,
How do I, get out of clinic and or not stay in clinic until 9 or 10 o'clock at night getting my charts done? So we start out there, and as we're talking, sometimes people send me their neurodevelopmental testing, which is not necessary,
yeah,
but often within the neurodevelopmental testing, you see the strengths. You
yeah,
see where people's strengths are. But it often comes out in coaching, and if I could go off on a tangent on a story,
yeah,
And this isn't a physician, this is an architect. But for me, the overlying arch is people who are what's called twice exceptional.
Yeah,
So intellectually gifted and also have a developmental disorder, which
yeah,
most physicians, in my opinion, have to be gifted in some way to get through medical training.
yeah,
So this architect that I worked with was amazing. He was very obviously very gifted, not just intellectually, but also from an artistic standpoint. But he was having difficulty, and he engaged with me to help with studying for boards.
yeah,
And what we discovered through coaching, because he felt like he couldn't retain written information. He would read and read and read something, and it wouldn't be retained. He did have a bit of a reading disorder, but what we discovered just through coaching was that he didn't even think about was he had a photographic memory for anything that he drew.
yeah, yeah,
And so what we discovered was that he was able to, as he was reading things, he could draw out if it was a code, like some sort of like drawing code, building
yeah.
code, even in meetings, because he had trouble sometimes retaining information in meetings, he could be drawing things out. And once he drew it out and it was on paper, it was hard coded. He never forgot it. And so we just came up with some different techniques that how he could draw from the strength in order to support his weakness.
That is amazing. And it's something that's I would believe that it's well known that with neurodivergence, even sometimes you don't study like others do, right? And so those are the folks that use that when they tell you that they are bad test takers, it's because they're trying to study in the normal, what we would call the normal pattern. Their readings like, okay, I spent all this time reading, or even test taking, right? Because the way they process information, like in the actual test, is very different. And so I'm excited. Like I said, I'm glad to hear that you are here supporting in that sense, where because it has left many physicians feel like they are the problem, right? And the problem is with me when they're struggling, not knowing that, look, they can actually channel this differently
Hmm.
and look at it like you talk from a different lens and be able to um overcome that barrier and whatever it is that has put that full stop says you can't get past
Right.
this level with them. So that's amazing, that story that you gave, very inspirational. Now what do you wish that physicians knew about neurodivergence that has nothing to do with labels or diagnosis?
We all have gifts.
Yeah,
Everybody struggles in one area or another. And I believe that there's a term called a spiky profile. And so what it means is that if you think of the drawing of a star, and these are the stars that have like their spikes at different angles, right?
yeah,
There's
yeah,
one that goes way out, and then there's one that goes a little bit out. And if you think of the space on the line, the further you are in one area, in to sort of, we'll say, to the right of the bell curve, there's going to be another area where you are further to the left of the bell curve. Nobody, we used to, and hopefully this isn't true anymore. We used to have this vision of like gifted children that are just good at everything.
yeah, yeah,
They
yeah,
read at 2 and they're doing, quadratic equations at 4 and they are amazing soccer players, and that's just not true. We all have areas, and if you excel at one area exceptionally well, like let's say that you have a photographic memory,
yeah,
you're what's called, you have perfect pitch,
yeah,
there is going to be another area where you struggle. And one of the big things about physicians is, and not just physicians, but twice exceptional people, is
yeah,
you feel, because it is such a huge difference, you feel it.
yeah,
Right?
yeah,
If you score the 99th percentile for math and the 4th percentile for reading, You're going to feel that a lot more than someone who scores in the 80th percentile for math and the 60th percentile for reading.
Absolutely. Absolutely. Well, thank you so much for sharing that. And I'm hoping that this just sheds more light on physicians who are in that spectrum of neurodivergence, and they are able to, like we talked about, just play on their strengths. Now, you did mention something, you've spoken about something called masking.
Mhm.
What does masking look like in medicine?
Oh, that's a great question. That's great. That I could talk about masking for a long time. So, what masking basically means is that you are pretending to look like everybody else.
Mm,
It does happen in people with ADHD. It happens in autistics a lot
yeah,
because autistics are constantly trying to exist in a world that causes extreme dysregulation.
yeah,
And
yeah,
it could be someone who, um, you know, gets extremely dysregulated in the chaos of a clinic.
yeah,
But they can't go and like hide in a corner and, put their hands over their ears,
yeah,
right?
yeah,
Or
yeah,
bang their head against a wall, which is just stimming, right?
yeah, yeah,
Do it. Now they might find another form of stimming. I know one autistic doctor who twirls her hair.
yeah, yeah,
Nobody
yeah,
would think of that as stimming, but that for her, she rocks a little bit and she twirls
yeah,
her hair and she's like, I know I can do this in clinic.
yeah, yeah,
And it does bother some people. She knows that, but it's like that's how I stay regulated.
yeah,
That's a form of masking.
mm,
She's trying to appear
yeah,
typical, neurotypical like everybody else.
yeah. Oh wow, like I'd never um thought of it in that way. Now, so for physicians who that is a problem, how did they overcome that though? Like that desire to be normal or to appear normal when normal, like I said, well, what people, because like I said, it's their normal,
It's normal
right?
for them.
It's
Right.
their normal. How did they get over that desire to be everyone else's normal? How does coaching help them do that?
Some people, so so coaching may not get over their desire to be normal, to not to to not mask.
Yeah,
And masking is like I'm gonna say not unregulated, but just sort of masking all the time without having any way to recover from it does contribute to burnout. Um,
mm,
sometimes paralyzing anxiety and career and shortened career poor health.
yeah,
Um, for some people, it is not safe to unmask.
mm,
Their job could be at risk.
yeah,
Especially people with other, conditions. I coached a physician who had obsessive compulsive disorder.
yeah, yeah,
His job would be at risk,
yeah,
likely, if
yeah,
he unmasked.
yeah,
And so we do talk about compensatory compensatory techniques. Like
yeah,
this was an autistic, and the way to work, the commute to work, sometimes she got to work and she was so incredibly dysregulated
yeah,
that her way of re-regulating, she had a couch in her office. She would have to lay on her couch. She had like an eye mask and just allowing permission, planning her day.
yeah,
And she lived in Manhattan. And she's like,
yeah,
I need to get to work more regulated. I'm going
yeah,
to walk the 40 blocks to work
yeah,
and leave enough time for that because I need to get to work more regulated rather than
yeah,
it was taking the subway that caused a lot of dysregulation for her.
yeah,
And so obviously it was more convenient,
yeah,
but she
yeah,
needed the time. She needed the recovery time. So instead of shaming, instead of saying like it's okay or trying to like coach somebody out of being dysregulated, allowing them and coming up with coaching, coping strategies and ways
yeah,
to re-regulate. Sometimes you have to take breaks during the day, we coach on you need to getting people outside of the clinic,
Yeah.
giving people the strength to either to advocate for themselves, like I can't have this lighting in this room. I can't have my office this close to the kitchen.
Yeah.
I can't
Yeah.
share my office with other people because all of the noise and the clack 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 and that's I can't do it.
Yeah.
Or
Yeah.
just charting, coming up with a safe way to advocate for themselves to chart someplace else, for example.
Yeah. Yeah, I mean, I'm glad, like I said, it's awesome just kind of just hearing these little things that, physicians who struggle in these aspects can do. Um, it sounds very awesome. And then, like I said, I'm glad to hear that you're creating a space for physicians in this aspect. Now, is it a myth that there are certain fields that physicians with ADHD thrive? Because sometimes you hear some physicians be like, oh, my ADHD allows me to function in emergency medicine, and I feel like this is where I can thrive. But if I decide to go into any other field of medicine, I probably will not do well in that area.
It is a myth. There is no studies that I know of that show that there is a propensity of people with ADHD in, emergency medicine or I mean, there are people with ADHD in every subspecialty.
Yeah,
And there probably I'm just trying to think there might be no one has ever studied it. I'm just trying to think of autism. There
yeah,
may be some there may be some subspecialties where autism, depending on your tools, because it's
yeah,
everyone's brain works differently. So,
differently. Yeah.
yeah.
Yeah, I mean, like I said, I think just when the world was somewhat exposed to that was, it's The Good Doctor? Could I be wrong? Was that the,
The good doctor is autistic.
yes,
The person that he plays a character who is an
yes.
autistic surgeon.
Yeah, so I think that was when, a lot of people got into that. They're like, oh my God, yes. I mean, you could actually have someone who it just became very visible. Or I mean,
Yeah.
it was one of the most popular ones where a doctor who has, autistic traits, but it could actually excel, right, in that aspect of medicine. So I think that was just a great exposure
Yeah. There's
with
an
that
entire
series.
there is an entire organization uh, that is called Autistic Doctors. I think it's based in the UK.
Oh,
And they published a study on autistic features in physicians and age of diagnosis, and 20% of people with ADHD have autistic features.
yeah.
So
Oh,
it's in the population, it's in our DNA. It's not just physicians, it's everyone. I mean,
yeah.
anybody, and you know, I kind of joke a little bit about certain things that I do, and I'm like, you know what? This is my little corner of the autism spectrum, and I'm very happy here.
That is awesome. Well, it's been a joy just kind of hearing and sharing your story and just how you are thriving in the space and also supporting other physicians through coaching. Um, Before we round up, I'll just like the last question I'd like to ask you is what would you say to a physician who feels like they've spent their entire career trying to be someone that they're not?
Find a good support, find a safe support person or group, and very slowly
Yeah,
and with a lot of compassion and grace for yourself, start to pull away at the sort of the veils
yeah,
that you've
yeah,
surrounded yourself with and start
yeah,
to discover who that person is, but very carefully and with a lot
yeah.
of support.
Yeah, yeah. But I'm hoping that anyone, who's listening that feels like you could be a really good support system would definitely reach out to you. So if someone's listening and they're like, I think I really need to hear more of this because I can just hear myself in the conversations that are being talked about today, how can they reach out to you?
Yeah, so I sent you a couple links. So the first is You can, if you just want to read a little bit about it, I've got a free ebook called Neurodiversity 911. It's 5 things that you can even start to do now if you even think you are neurodiverse. It's helpful even for people who aren't neurodiverse, but it is aimed
Yeah.
towards people that are neurodiverse. And then I also sent you a link. You can just sign up to talk to me. It's a free call. I call them the What Now call. And happy to talk with you about what it is you're struggling with and what it is you might want coaching with. And the website is just neurodiversedocs.com.
So and I would definitely put all those links into the show note. But Dr. Sodaitis, thank you. Appreciate your wisdom, your insight, your gifts that are being shared in the physician community. Just being a vision board, I would say, for those who are trying to navigate how to help others in the realm of coaching, also in the sphere of leadership. You've shared some great insights with us today, and I appreciate it.
Thank you for having me.
So if you are listening to us, this is Physicians Keepers. It's what we do. We have physicians come in and share their stories. If you believe you have a story to tell that you know would make another physician feel supported, seen, and heard, we would love to have you on. You can send me an email, drremlo@gmail.com, and I'll put all those links in the show notes. And just come in and let's just have a conversation. This is what we do. Dr. Sodaitis has been an amazing physician's keeper today. She gets her physician's keeper's badge. She's made, us feel, any physician dealing with neurodivergence, she's made them feel supported and seen, knowing that there is a safe space for them where they can receive coaching and help. Thank you, Dr. Sodaitis.
Thank you.
And right before we go, as at the time this will probably come out, for anyone who's listening, a physician, I wrote a book, and this is me shamelessly trying to promote my book. It's called Captain Cardio and the Heart Ranch. It's a kid's book, but it explains the heart in a way that's fun and engaging for kids, where it's not scary. It's not some great mystery. We have an adventure with Captain Cardio through the heart. We have a villain. Of course, every superhero has to have a villain that he fights. And our villain is Placky. And he takes I know, I just couldn't help it. Alvin is Placky, and we see kind of the showdown between Captain Cardio and Placky. So by the time this episode is out, this should be on Amazon. The print version is coming out, so June the 16th. The ebook is already out on Amazon, and the print version will be out by the time this episode comes out. So grab a copy for your kid, grab a copy for your kid's class. I just think like I said, I had so much fun doing this. It was a lot of stress. I didn't know writing a kid's book could be such a thing. I had no clue when I started this, but 2, 3 years down the line, it's out, and I'm really glad that it came, what was in my mind was finally be able to come on paper. I had an amazing illustrator, and he just made my vision come to life. So grab yourself a copy. I'm learning marketing, so this is my shameless ploy with this. But it's been a joy having you all here today. Hopefully you join us for the next episode. We definitely would talk to another amazing physician, physicians keepers. Share, like, subscribe, share with another physician that you know would definitely benefit from this, because that's how you support our physicians and just become an amazing physician's keeper. Thank you.
Thank you.
Thank you for listening to Physicians Keepers. I hope today's conversation gave you something useful to carry into your life or practice. If it resonated, share it with another physician who might need it. And if you have a story that could help someone else, I'd love to hear from you. Connect with me on social media or send me an email. See you in the next episode.